We have a strong history at the university of interprofessional education. There's a lot of things we've done well that have worked. Our team members regularly present and publish. And so there's that outreach that we not only do things at our university, we share them. We spread that knowledge nationally and internationally through publications, conferences, and so on. So what we're really focused on now is tackling how to progress this high quality IPE, the interprofessional education, into the clinical and community learning environments. And so when you speak about the changes with COVID, with telehealth, we need to rapidly adjust out of the classroom. It's even more important now that we do so to help our learners transition quickly to the working world and to the clinical environment. So we want to be leaders, especially in overcoming some of the common barriers in IPE. And we are not afraid to try new solutions to old problems. So how can learners, for example, engage in collaborative practice in rural areas in greater Minnesota when there's only one or two provider types at their location? So let's design cross-system partnerships in geographic clusters and implement a student-driven curriculum with little to no burden on the sites. I mean, why do students need to be located at the same place at the same time? That's an old model. Why do we try to stick with that? We could pioneer asynchronous longitudinal projects or use technology to connect through telehealth and perhaps reach communities that we are not currently serving well. How can we know the locations and the timing of student placements for our 28 health professions programs across the Twin Cities, Duluth, Rochester campuses? No, let's design a centralized database with streamlined reporting options. We can then use data to intentionally create new authentic opportunities during the placements. And that's key. It has to feel relevant for the learners to see themselves applying those skills in practice. And we can include professions that maybe are less frequently represented in IPE, medical laboratory sciences, veterinary medicine, dentistry, public health, and others. So I pose that question, why do we do things the way they've always been done when we all know that we need change? It's not currently enough.